Serious complications of pregnancy. It's extremely essential to follow self-care measures and go for routine checkups to lower the risks of serious complications of pregnancy. Pregnancy is the most important phase in a woman's life, during which the woman undergoes certain physiological, hormonal, as well as psychological changes. There's a need to take care during this time due to the possibility of conditions such as anemia, high, low blood pressure, or gestational diabetes. These complications could affect the mother, as well as her unborn child. Complications. Most pregnant women minor problems such as vomiting, nausea, constipation, temporary hair loss, etc. Although major health problems are rare, they can occur in some cases. For instance, hyperemesis gravidarum refers to an extreme form of morning sickness that is characterized by persistent nausea and vomiting, which in turn can lead to weight loss, as well as dehydration. A woman's overall health can play a significant role in preventing these conditions. Some of the most critical problems include diabetes, severe infections, ectopic pregnancy, molar pregnancy, heavy bleeding that increases the risk of miscarriage, severe vaginal infections, and preeclampsia, a condition appearing after 20 weeks that causes high blood pressure and problems with the kidneys and other organs. The risk of developing serious complications of pregnancy is higher in overweight women, as well as women addicted to alcohol, tobacco, and illegal drugs. Some of the serious problems that can occur before, during or after childbirth are preterm labor, allergic reaction to medications, high blood pressure, which can worsen with labor, failure to progress through the stages of labor, infections, problems with umbilical cord, prolonged pregnancy, uterine inversion, postpartum depression. They could experience heavy bleeding before, during, or after labor. It may result from uterine atony, loss of tone or the failure of the uterine muscles to contract, or major tears or cuts in the birth canal, bladder, or rectum. There may be some issues regarding the placenta such as placenta abruption, placenta accrete, retained placenta, or placental abruption. There may be failure of embryo to implant in the womb, which may result in miscarriage. This condition is known as ectopic pregnancy. Under normal circumstances, the fertilized ovum itself implants in the uterus. In ectopic pregnancy, the embryo gets implanted in other areas, usually in the fallopian tubes. As the embryo develops, it pushes against the fallopian tube and weakens its walls. This might result in bleeding and rupturing of the fallopian tube. Some of the warning signs of this condition are abdominal pain, generally at one side, shoulder pain at the same side, fainting, and possible bleeding. In such cases, embryo should be removed from the fallopian tube. There is a possibility of preterm labor in some women. Some of the warning signs include changes in vaginal discharge, bleeding or leaking fluid from vagina, contractions every 10 minutes, dull backache, and abdominal cramps with or without diarrhea. If a pregnant woman gets good prenatal care, several complications that are likely during this time can be managed or prevented. Therefore, it is very important for the woman to go for all the scheduled checkups during this period.